Did you know Governor Lombardo vetoed a privacy bill that would have helped protect both your privacy and your doctors? Let's talk about it. Assembly Bill 411 would have allowed doctors to display their practice name, not their personal name, on the label of certain prescription drugs. Those included mifepristone, misoprostol, or their generic alternatives. The drugs are used for many reproductive health purposes, including medication abortions. By putting their names on the labels of the drugs, physicians are putting themselves at risk of threats or violence from anyone who finds the bottle and feels the woman it was prescribed to shouldn't have an abortion, like a domestic abuser, for example. In his veto letter, Lombardo, a Republican, said he understands the privacy concerns behind AB 411, but he thinks it would reduce transparency and care to only list the name of the clinic where the medication was prescribed. I wanted to know if this rang true for medical providers who are working during this very heated time to help their patients. So I talked to Dr. Margot Lazarine, a medical director at Planned Parenthood Marmonte, which has clinics throughout Nevada and California. Here's what she said to me. I don't think it makes sense to veto it for that reason. We have medical records and we can always follow and track internally who is caring for a particular patient. So transparency doesn't seem to be the real problem here. What's at risk for the providers and patients then? Here's what else Lazarine had to say. I'm worried about the prescription bottles getting into somebody else's hand. Whether that's an abusive partner, an angry family member, or maybe even a neighbor, our medical care should be private. In his veto letter, the governor said, we must prioritize clear communication to protect those seeking care. I don't know about you, but if I needed to communicate with my provider, I'd much rather have the name of the clinic on the bottle. Are you going to Google the doctor's name and call their home number? No. You're going to Google the clinic's number and get help from the first person you can talk to. After talking to Dr. Lazarine, I'm having a hard time seeing the sense behind the governor's veto. For more on this and other stories important to Nevadans, please sign up for our free newsletter here.